So, good morning, ma'am. Today, I will perform upper airway suctioning and tracheobronchial suctioning. First is the introduction. Suctioning is described as the mechanical aspiration of pulmonary secretions from a patient with an artificial airway in position. The decision to suction should be based on individual patient's assessment and the following clinical signs that may indicate the need of suctioning. Suctioning should be done as rarely as possible as frequently as needed. There are two types of suctioning. First is the upper airway suctioning. Upper airway suctioning, it is the insertion of a suction catheter connected to a suction machine or the wall outlet into the mouth, nose, and pharynx to remove excess secretions from the respiratory tract with the application of a negative pressure. Next is the tracheobronchial or the endotracheal suctioning. It is the process of applying a negative pressure to the distal endotracheal tube or the ETT by introducing a catheter to clear excess or abnormal secretions down to the trachea and bronchi. The purpose of this suctioning is to remove excess mucous secretions, to ensure the patency of an altered or irritated airway by removing excess secretions. And last is that to minimize pulmonary complications like pneumonia that results accumulated secretions. So, assessment. Assess for clinical signs indicating the need for suctioning. First is the restlessness, gurgling sounds during respiration, adventitious or the abnormal breath sounds when the chest is auscultated, change in mental status, skin color, rate and pattern of respirations, pulse rate and rhythm. Assessment is necessary before and after the suction procedure. Next is the assess the clients for the presence of congestion on auscultation of the thorax, in order to know if the patient has productive cough and secretion that are audible or visible. Next is assess patient for epistaxis, injuries from the neck up and reactive airway disease, and coagulation problem if nasotracheal or nasopharyngeal suctioning is ordered. In order to ensure the patient's safety and avoid any complication before doing the procedure. Next is the note the client's ability or inability to remove the secretions through coughing, to know if the client is able to cooperate in doing the procedure. Next is check physician's orders and patient's care plan, to avoid any errors in doing the patient's care. Planning. Oral or oropharyngeal suctioning using a Yankauer suction tube can be delegated to unlicensed assistive personnel or UAP and the significant others if appropriate. The nurse needs to review the technique and important points such as not applying suction during insertion of the tube. Oropharyngeal or nasopharyngeal and tracheobronchial suction that uses sterile technique requires application of knowledge and problem solving and should be performed by the nurse in order to avoid any infection and spreading of germs to the patient. Next is administer pain medication prior to suctioning if needed, in order to ensure the client comfort if the client endure pain when doing the procedure. Ventilate tracheostomy patient if patient has copious amount of secretions. This is to provide an air passage to help the patient breathe properly. Obtain a second person to ventilate patient during procedure if necessary, in order to ventilate the patient properly. Position unconscious patient on his or her side, to maintain the comfort of the client for easy access in doing the procedure, and gather equipment and supplies. Perform hand hygiene. and apply proper personal protective equipment or the PPE provided for patient privacy. This is to gain patients' trust and as well as provide patients comfort. Good morning, sir. I'm your nurse today, John Micoritado. May I know your name po, sir?
Villanueva.
And may I see your wristband? And today, sir, is mag-perform ko kuan sa imo, suctioning para kini siya is kanang para ma-relieve ang imong breathing. Okay lang ba, sir? So, first is we need to position the patient semi-fallers. That's it, bro.
Okay.
Pwede busy ni nakuha sa marit.
Pour sterile water or saline into the container. This is for easy access when you use it to the procedure to save time and effort. Measure the distance between the tip of the client's nose and the earlobe or about 13 cm in order to have a proper measurement of the catheter to the patient's nose. Mark the position on the tube with the fingers of the sterile glove hand. Insert the catheter to the pre-measured or recommended distance into either nares and advance it along the floor of the nasal cavity. Never force the catheter against an obstruction. If one nostril is obstructed, try the other.
The next is the oropharyngeal suction.
Pull the tongue forward if necessary using gauze. Insert the catheter using the dominant hand. Advance the catheter about 10 to 15 centimeters.
Next is the endotracheal suction.
Disconnect patients from ventilator and introduce suction catheter gently to require depth. Apply suction 5 to 10 seconds while slowly withdrawing the catheter. Then remove your finger from the control and remove the catheter. Clean the catheter and repeat suctioning as above. Wipe off the catheter with sterile gauze if it is thickly coated with secretions, and dispose of the used gauze in a moisture-resistant bag. Dispose of the catheter, gloves, water, and waste container. Wrap the catheter around your sterile gloved hand and hold the catheter as the glove is removed over it for disposal. Wash hands or sanitize by using alcohol. Ask the client if he is comfortable in his breathing.
Mong paminaw karon sir na mas kuan mong ginawa karon mas okay. So, thank you sir. For the evaluation, assess the effectiveness of suctioning, auscultate the client's breath sounds to ensure they are clear of secretions. Observe skin color, dyspnea, and level of anxiety. In order to know if the client airways passage is clear that client can breathe properly without any uncomfortable feeling. Perform a follow-up examination of the client to determine the effectiveness of the suctioning, respiratory rate, depth and character, breath sounds, color of skin and nail beds, character and amount of secretions, suction, changes in vital signs, and relate findings to previous assessment data if available, in order to stay updated and offer better patient care. Report significant deviations from normal to the physician. Documentation. Document relevant data. Record the reaction of the patient in suctioning, including the amount, consistency, color, and odor of secretions. Foamy, the white mucus, thick, green tinge mucus or blood fleck mucus, and the client's breathing status before and after the procedure. If the technique is carried out frequently, it may be appropriate to record only once at the end of the shift. However, the frequency of the suctioning must be recorded. This is to provide correct account of treatment and care. Thank you.